welcome to the stage Deborah Scher and Reed Tuckson.
Thank you all. Thank you, Deborah, for joining us. You are the executive advisor to the Secretary of the Department of Veterans Affairs, where you are responsible for developing big, bold collaborations with private sector entities and others to advance the mission of the VA. When most of us think about the VA, I don't think the word innovation is the first thing that would necessarily come to our mind. Tell us what's exciting about what you're doing.
Oh, there's so much that's exciting about what we're doing. And Reed, I'm going to challenge your assumption, because the VA trains 70% of all physicians in this country. Just curious, by a show of hands, how many people in the audience did their training or worked at the VA at some point in their career?
Yeah.
Fantastic. Well, thank you for your service, and I think you, Reed, and the others know what an innovation ecosystem the VA can be. And a lot of the firsts that happened at the VA, you may all have been a part of. So for those of you who don't know, the VA is the closest thing we have to a national health system in this country. We serve 9.5 million patients. We have 170 medical centers. We have 1,070 community clinics. We saw 60 million patient appointments last year. And an independent VFW survey said that more than 90% of veterans would recommend to other veterans to get their care at the VA. And so because we take care of veterans from the time they leave the service to the time they leave this earth, we are passionate about prevention, and we are driven by healthcare outcomes. And so we can claim a long list of firsts in innovation. The first liver transplant, the invention of the pacemaker, the creation of the first electronic medical record, the first health system to eradicate Hep C, and the creation of the Gleason score for staging prostate cancer.
Wow. Do you, I know that you also are doing some stuff in AI as well, and how would artificial intelligence play into your portfolio?
So because we take care of veterans from the time they leave the service till the time they leave this earth, and now the Department of Defense and the VA have all agreed to migrate to the Cerner electronic healthcare record, we have the largest longitudinal database in this country, combined with the Million Veteran Program, which is a genomics collection program, which the goal is to collect it from 1 million veterans, and we're past 750,000.
Oh, congratulations.
So thank you. It's been a major effort. So we have a great treasure trove of data, and as other speakers have talked about, both from the government and the private industry, we are actively going through the process of figuring out what are the right ethical standards for sharing this data.
Got it.
And doing analysis.
One of the, as we've talked a couple of times this morning already with, is that we are concerned about how do we get more participants into clinical trials and segments of the population that may be underrepresented.
Yes.
I know that you have a particular interest in rural America, and I think it's very important to try to see what you're doing there, and there may be some things that you are doing that will be things that people in the audience may be able to connect with in the future. Talk a little bit about what you're doing.
I'd love to. It's become a passion of mine, and I think there's a role for everyone in this room to participate. So just to give some context, I lead the Secretary Center for Strategic Partnerships. Our mission is to go out to industry and find that sweet spot between the Secretary's most important priorities and industry's most important priorities, and together create big, bold, impactful partnerships around those missions. These partnerships from my office are all donated services, either donated to the VA, expertise and resources, or programs that are provided free to veterans. And so we have put together mission-driven coalitions around suicide prevention, precision oncology, AI, and rural health with telehealth that really is the foundation. So I'd love to tell you more about what we're doing in rural health.
Sure, I think do we have a video on that telehealth?
Well, we're going to wait 1 minute. Just let me set the stage. So the VA serves 9.5 million veterans in this country. 19% of Americans live in rural communities. 25% of veterans live in rural communities, and 33% of the veterans we serve live in rural communities. Wow. So the Secretary said, how do we reach every single veteran in America? The VA, some of you who have worked there have probably been very active in our video telehealth program. We've almost doubled the number of video telehealth visits in the last 3 years. It was 1 million video telehealth visits in 2018, 1.3 million, up 30% this year. And we said, okay, what are the barriers to bringing that service to rural America? One was people live in places that don't have broadband access, and people sometimes can't afford the data plans that are required to support that. We went to the carriers. They all zero-rated the VA Video Connect app, meaning veterans and caregivers get no charges against their data plan when they connect for telehealth. The second challenge was, how do we build a footprint in rural America without spending taxpayer dollars to build new buildings? We made a map of where all the VA medical centers are, where our veterans are, and who had to drive the greatest distance to get care. We overlaid on that a map of Walmart stores. 90% of Americans live within 10 miles of a Walmart. 90% of veterans do not live within 10 miles of a VA medical center. So we went to Walmart and said, in select areas that are priority for us, will you dedicate a room where veterans can come and piggyback off of your broadband and connect with their VA provider via telehealth? And that first ribbon cutting is going to be next month, and we're very excited about that. Well, thank you. Thank you. So who else has a rural footprint? Well, the VFW and the American Legion have posts all over America. And so Philips stepped up and said, we're going to donate the telehealth equipment to create remote telehealth exam rooms in rural America. And they went to their first VFW to figure out how that was all going to work, and they said, these are not healthcare facilities. We are going to actually have to dedicate, and we're going to have to create a remote exam room where veterans can go. I'm showing you these 3 pictures. We're going to go to a video, but I want just look really carefully at these parade floats, and as soon as we finish the video, we're going to come back and talk about what they mean. So if we could show the video now, that would be great.
Terrific. Go to the...
With the implementation of the Historic Mission Act, the U.S. Department of Veterans Affairs is extending access to health care for veterans who live in rural areas. VA is exploring ways to leverage new resources and technologies to provide world-class care for veterans who live far from VA facilities.
Here in Linesville, Pennsylvania, there is no masses of population here. We're out in the middle of nowhere.
Here in Los Banos, California, we have some homeless veterans. We have a lot of veterans that are elderly, that are on fixed incomes and don't have the capabilities of getting to the doctors.
Right now we have absolutely no service for the vets here in Eureka.
Our closest VA hospital is in Helena, Montana, which is 4 hours away.
Telehealth is vital to increasing access and removing geographic and digital barriers to care. The VA achieved more than 1 million video telehealth visits last year. Not only a record-breaking year for the department, but also 94% of patients were satisfied with their visits.
The VA has a mission to deliver best-in-class service to veterans everywhere. We can be much more successful if we have strong and effective partnerships. Philips said, we're going to contribute our design expertise and help you create this exam room, which can then be stood up in VFW halls, at American Legions, in any place in rural America where there's broadband access that veterans can come in and speak with their VA providers.
Philips knows that if you can track someone's blood pressure, oxygen levels, body mass index weight, then clinicians can help their patients stay healthy.
When I need to see the doctor, I need to travel 70 miles one direction and drive back 70 miles. The fact that this is so convenient is going to make a difference in people's lives.
So it's with projects like this where we have that connectivity and we have a therapeutic environment, a space where the community can rally towards and really build something meaningful. This is the way of the future.
Good.
So the float that you saw, the pictures of the float, thank you. We're so excited about this. In Eureka, Montana, which was the first co-creation session, Philips brought a huge design team. We brought VA people, veterans, caregivers. It was really the voice of the veteran that created that. So Eureka was the first session. They took the foam board that they used in that co-creation session and turned it into a float that they then led through their town parade. They were so proud. So this is something that was conceived in Washington, really designed by rural veterans in Eureka, Montana, 8 miles south of the Canadian border and 4 miles from the VA Medical Center. And it was powered by industry with Philips and a coalition of Steelcase, CareLinks, and others, and it will truly change healthcare for all Americans, we believe. So you're all part of this mission. We would love to work with you, and we thank you for the opportunity to tell our
Deborah,
story.
this is terrific. We'll leave it there, but I think you'll be around, and I think that I think we can obviously see that this is a chassis that you can run you can build upon.
Absolutely.
And so I think there are other utilities that are clearly here, and I think we just have to find a way to make use of this and for all the purposes that are of importance to the audience. So thank you so much for doing it.
Thank you.